welcome all to this Next Plan Knowledge Sharing webinar series. This is our initiative and our effort to contribute back to the industry through which we have gained a lot. This is 6 in the series and we'll continue on these efforts in future also. So friends, before we move ahead on our journey today, I would first like to express my sincere gratitude and namaskar to everyone who has been involved directly or indirectly in the fight against Corona and protecting lives. And special thanks to all my friends from the field who are braving odds. We would like to pray for your safety and all of you to stay healthy. So let's start now for our wonderful learning journey for today evening. So as I said, friends, this is the first open webinar for pharma ABMs. Therefore, a big welcome and swagatam to all of you from all my colleagues in Next Plan Consulting. This is called as S, which is an acronym for ABM Capability Enhancement for the New Normal. A brief introduction to Next Plan team before we move ahead. So we are relatively a new outfit. We started somewhere in April 2018, so just completing about 2.5 years. And in these 2.5 years, we have had the good fortune of working with companies across the spectrum of pharma industry, whether it is companies who are at the top of the ladder, companies who are at midway, there are Indian companies, there are multinational organizations, and every project with every company for us has been a different project. It's not just pure training delivery. So a lot of work in terms of capability enhancement, process strengthening, contributing to sales and marketing teams so that they perform better in their day-to-day work. Together, Next Plan team brings with you relevant experience across the industry, across various positions, and across company of over 200 years. And we have expertise and exposure to various therapeutic classes as well as different size of companies. Friends, this is me. I've been through and through a boots canal Abbott person. Over 36 years of strategic, operational, team building, leadership experience in training and development, sales and marketing, sales force effectiveness, employee health and safety, and field force engagement. I retired from Abbott in August 2018 as Associate Director for Sales Training and Development. My coordinates have been given in case anyone would like to connect with me. Please feel free. I'll be more than happy to share thoughts and connected with you. So we'll have the first poll wherein we would like to know from you, being directly in touch with the markets, leading your teams effectively in the market. What are your top sales challenges? So the first question focused on understanding your top sales challenges. And as I see, a large number of participants have said that it's large number of low contributing doctors in the doctor list is emerging as one of the top challenges, followed by there are many doctors in the list of our team members who are contributing either 1 or 2 products for us. And both these factors would obviously would lead to inconsistent sales performance because large number of doctors as per this poll results are not contributing adequately. People have also expressed concern about low new product success rate where industry quite often comes with new products. Success of that is comparatively low. So that's another challenge. There are some participants who have also talked about high attrition. Most of the people have said about 2 days, 3 to 4 days is some participants, which is spent by their team on sales closing in a month. And if we extrapolate it to a year, it comes to about 24 days. So almost close to 1 month, the teams are spending on sales closing. Last 5 months, our life has gone topsy-turvy. So as Marshall Goldsmith has mentioned, what got us here won't get us there to the new level. And therefore, as the new scenario post-COVID is unfolding, there is a need for new skills to be learned. There is a need to reskill ourselves. There is a need to upskill ourselves on some of the areas, which is a very strong need of the hour. And today's session, friends, is focusing on exactly this aspect of what will be the key areas of skills that would be relevant for our ABMs in the industry. So let us first start by understanding some of the important skills. Based on the survey results, what you have mentioned, that a large number of doctors are low contributing doctors, and therefore there is obviously more pressure for the sales teams to accomplish their targets. And therefore there is a definite need to move towards demand-based performance, which means that we'll have to take cognizance of contribution from each of our doctor in the list. We'll have to see how do we drive increased contribution by guiding our teams, and that's where your leadership role will be critical. And therefore the whole scenario is driven by increased prescriptions in the marketplace. The other critical area will be data analysis skills. So as managers, we are aware of the fact that you work on a lot of different data points. So you have the sales numbers, and in that also there are primary sales, secondary sales, you have trend analysis, you have product-wise analysis, you have territory-wise analysis. So a whole lot of data around sales. Then you work on the coverage data, which is coverage of customers, call averages, and whole sort of data around that. There is other component of the data you work upon as a leader is related to your people. So their skills, their knowledge levels, the attrition factor, how they are performing, how they are not performing. And in addition, there is another angle, which is process related data. So are the guys sending reports on time? Are they adhering to the policies and processes of the organization? So in a nutshell, as managers, you work a lot on the data part of your job. And therefore important will be, while these data points are different, so sales numbers will come from one side, coverage data will come from another side. As managers, what you need to look upon first thing is to get this data into one single Excel sheet maybe, so that you have complete view of various aspects of your job function. The data starts telling you different stories which are connected to each other, and based on that your action planning will be more relevant. So while the data input would be from different sources, as managers, one of the important skill what we need to build upon is how do we collect the data and put it in such a way that it starts telling us a story as to how should we drive meaningful conclusions from that, and it should lead to definite and concrete action. The third area which is emerging very strongly in the last few months is a remote engagement. And this will impact all three aspects of our work. One aspect is how do we engage with our head office. There will be a lot of meetings which almost every one of you would have experienced are happening digitally now. Previously, there was a concept of cycle meetings every 2 months, 3 months, but I think that is a past now. The cycle meetings are happening through Zoom and Microsoft Teams and whatnot of the digital platforms. The head office conversation is through digital medium. Similarly, on the other side of the spectrum is your team. With them also, previously like you used to be there in the market day in and day out. But many of your interactions now would be driven digitally, though the market working has started, especially in the last couple of months. And the third area about remote engagement will revolve around your customers. All of you would have seen this, and you will appreciate the fact that most of your doctors are experiencing and they are expecting that the field team should meet them either through a physical visit, but also to a large extent through various digital interfaces. Even the doctors, the way they are managing their patients, there are a lot of teleconsulting happening, video conferencing happening with their patients. So this remote engagement part is going to be of great significance as we move on in our career. The last aspect would be people management. The team's requirements would be changing. The performance management processes will be changing. The work expectations from the teams would be changing. And therefore, the way we were managing our teams previously, maybe a different way of managing our teams would be required in future. A lot of our teams are younger today. They are from the millennial generation. Their expectations, their lookout for the life is different. And therefore, while we carry our work X of 15, 20 years in the industry, the expectation of our team, especially the young guns, would be different. And how do we reorient our thinking to manage the expectations of the new, the young members of the team would be relevant. So these are important skill sets for ABM. But today, we are going to focus on one particular aspect of our work, which I'm sure you will agree has undergone tremendous change. And that aspect, friends, is revolving around our customers. And that puts a demand on us that we relook at the way we manage our customers in the times to come. We need to take a much more holistic look at the entire customer management process, what we undertake. And that is an area which would put a demand of maximum change. So next few slides, we would like to spend a little more time to understand this critical aspect of our work. Uh, One change we expect based on our interactions with various industry leaders is the need to look at every single doctor in our list and to manage that customer as a key account. Formerly, the key account concept was more connected to managing a big hospital chain, maybe a big institution, our tender business, all of that being construed as a key account. But moving ahead, I think the need would emerge where we'll have to look at every single customer as a key account. Now, what does it mean? That the way we understand our customer, the way we gather information around our customer would be significantly more. Previously, maybe the focus was plan a day's work, maybe 10 doctors in a day, go and meet them. But in future, the time would be, okay, this is a customer we plan to meet. What is the profile of this doctor? What is the expectation from this doctor, and how we can strategize to get those business objectives? Also link it to the survey results, what you have mentioned. A large percentage of people have said that there is a significant portion of our doctor list which is a low contributing doctor list. And that is another reason why we'll have to look at every single doctor in our list as a key account and see how can we drive incremental contribution from these doctors. So we'll have to go possibly beyond the normal profiling, which was restricted to maybe demographics and geographic profiling, and understand the doctor in much more detail. We'll also have to add to that the business profile, which is the potential and support data, set a very clear business objective for every single customer, which is understood by our team member, and he has a strategy to convert that doctor based on the business objective. We also have a balance of core and non-core doctors. Every organization, every team, every company has this concept. So there will be a set of customers, and a popular saying is a 80-20 rule. So we have about 20% of our doctors who contribute significantly to our business. Needless to mention, the whole company, right from a representative to senior leadership, is very strongly focused and concerned, and all the efforts revolve around this set of customers. So there obviously is going to be continued effort focus around the core doctors who bring the largest part of moolah to our sales. Without them, we won't be able to complete our budgets. Absolutely agree. But if you link it to, once again, I would go back and maybe I could be going back to this point again and again, is the large number of doctors who are not contributing, and we'll have to make very, very conscious efforts to understand the opportunity in this large set of customers and how do we leverage that opportunity. So on one side, we balance and continue to get contribution from the core customers. On the other side, as leaders, you will have to guide your teams how to leverage that opportunity in the doctors who are not contributing today. And this would mean that there has to be a very strong and conscious effort on building our team capabilities, understanding our team capabilities, and guide them how they can approach every customer differently. And I think that is the whole ball game which is going to come up, and each one of us should be ready to play this game much more strongly, much more aggressively in times to come. Now, for this to happen, as we said, the understanding about the doctors has to be very, very strong. By and large, every person in the field, based on our experience, time spent in a field, almost every person in the field knows a doctor in terms of what brands the doctor is writing for me. I'm sure every person in the field would be knowing about it. To a large extent, people would also be knowing the overall potential of the doctor. And this is the core of understanding the customer, definitely. So the business profiling of a doctor, which would involve the support component and the potential component, would be the core on which we should set the business objective for a customer. There would be other aspects of business profiling, which would mean considering if we are in a chronic therapy, say for example, epilepsy management or diabetes management or a cancer management. One important element to understand there is what is the number of new patients coming to the doctor's clinic, because the growth there in terms of prescription is going to come from the number of new patients the doctor is going to treat. Because many times in the chronic therapy, the change in prescription or change in molecule is quite tough. So the growth opportunity there would be from the new customers, and therefore we must know what is the number of new patients a doctor would see. So once we set a business objective, that is the core of the profiling. The other set of information what we have about our doctors is the demographic and geographic profiling, which all of you know, you are masters. That is relevant when we plan our doctor list, we plan our coverage, we do our daily work planning. So the demographic and geographic profiling would come into play during these aspects of our work. But there are two more sets of information about our doctors we must focus upon. One is to understand a personal profile, and the second one is the professional profile of our doctors. So when we say personal profile, it means to understand a doctor little more in depth. So what are the doctor's interests? What are his hobbies? What are his likes? What are his dislikes? What are his preferences? What are his belief patterns? Is he a foodie? Is he a sport enthusiast? Is he a music loving? Now we'll see how this information would come into use when we are actually creating a strategy for a doctor. So that is one part of the doctor persona. Understanding the interest areas broadly, if I can say, about a doctor's personal profile. On the professional side, the biggest requirement which has come up today in the last 5 months, and I'm sure you will resonate with this thought, is the digital preferences of the customers. Now, come COVID, when the doctor's physical meeting stopped, every company took up very strongly the digital bandwagon of meeting a customer. And we have multiple ways and platforms available with us to reach our doctors. But every doctor has different requirements. Every doctor wants the field people to be connected with them differently. So understanding the digital preferences of a doctor is one of the key requirements that has come up through post-COVID period. What is the orientation of the doctor? Is he a knowledge-oriented doctor? Whether he's concerned about the patient outcomes, patient safety, patient's efficacy, whether he's a commercial-oriented doctor, does he recognizes that the company should contribute to increasing his connect with his colleagues and the patient's footfall? Does he value relationship? Does he value various accolades? So what are those professional behaviors and preferences of a doctor? So we have talked about the business profiling of a doctor, which is at the core. Then we talked about the demographic and geographic profiling of a doctor. We have also looked at the personal and professional profile of our customers. Now, once we set the business objective for a doctor, say either in terms of value that we want to increase support from Dr. X from a level which is at a particular support level to a next level support. Which are the brands possibly that could also be focused upon. But from the personal and professional profile of a doctor, what would emerge is the convergence strategy for a doctor. So setting business objective is one, but how to achieve that business objective is the play that will be more important and that will become more relevant in times to come. So gone are the days when telling the med rep that we should increase the support of the doctor from say 5,000 to 10,000. I think that will not cut ice. We'll have to look at how do we get that achieved? What strategy we add off for every single doctor? Even we are promoting two brands, the strategy and approach for brand one and brand two could be different. Maybe for brand one, there are more opportunities to get increased doctor prescriptions by promoting higher indications or talking about different dosage schedules. For brand B, the approach and the opportunity could be different. And therefore, we cannot afford to go ahead a straight jacket approach for trying to convert a doctor. The activities would also play a big role, but what will be those activities relevant for that doctor chamber, that particular product? So it has to be a mix of different factors when we are creating a strategy around that customer to get that conversion. And my earnest appeal to all you leaders in the market is, instead of just telling your representative, your team member, and asking him to increase secondary by so much rupees, or aim to get an increase prescription support from a doctor, try to help him to write down, create a conversion strategy for that particular doctor, for that particular brand. And I think your contribution will be of great help to your team members in this aspect of your work. Let's move on to the next step is, how do we map the different touch points considering the digital orientation of a doctor and the professional stature of a doctor. All of us are familiar with the super core and others concept, but there is another classification which is emerging, is how savvy or how comfortable our customers are in using the technology. So people are already starting to talk about a customer who is very digitally savvy, which means he is absolutely comfortable using different technologies available. He is on top of the different technologies which he can use for doing his job effectively. There are doctors who are physically, digitally comfy, which means they know the technologies, they are comfortable, but may not be a level of expertise of using technology. And there are doctors who would be maybe even today not comfortable using the technology as effectively as one should. So this is one set of classification of our customers. On the other side, we have the traditional way of classifying, that is super core, which are our top 20%, then the next, and then the next. So these are the two ways our doctor list can be bifurcated. But important is, based on these two buckets, whether it is on the technology classification or on the business classification, what are the engagement tools we use to drive the customer conversion, which we talked at length on the previous slide. The digital inputs, though being used in the pre-COVID period also, but I'm sure all of you will agree if I say that in the post-COVID period, the use of digital interfaces have increased manyfold. Suddenly there was outburst of webinars, ECMAs, chat rooms, roundtable meetings which had gone online, ad boards, online patient support programs, video conferencing, WhatsApp, SMS, audio call, email, website. My God, the list is exhausting. We have websites, FB, Twitter, Instagram, LinkedIn, text messaging, online journals, and so on. So all of this just exploded in our face post-COVID with a magnitude of force that it was really sort of pushing us back for a moment. But all of you have come back very strongly in the last few months, and I see through my interactions with my friends in the industry that you are effectively using various digital interfaces to connect with your doctors very effectively. But the important change now is, while we have a bucket of various digital interfaces, there will be a lot of initiatives work done by our marketing. The expertise at your level and at your team's level would be how to fit which digital initiative with which class of customers. From the bucket, should we go all to all? Should we pick and choose based on the doctor profile? If I have to decide pick and choose, then which one, which set of doctors, will it be only one intervention, one touch point, or combination of touch points? I think though that's the expertise as leaders we'll have to build in. Then we have got e-detailing, which was started maybe a few years before, virtual detailing or remote detailing, which have also come up. So all these are aiding to the physical meetings. Our team members are already connecting with their doctors. Then on the other side, we also have the conventional inputs like the physical visits. And all of you have said at the start of the poll that around 7 to 8 doctors have started meeting us. There could be different ways today it is happening. Maybe doctors are keeping some distance between you and them for the time being. Maybe that's a precautionary measure. I've also seen on WhatsApp some updates that there's a speaker outside the doctor clinic, you are talking in that speaker and somewhere inside the doctor is listening to you. So there are different things which are happening and they will keep on evolving over a period of time. So that is as far as your physical visits. Then samples, literatures, these would keep on coming as the business unfolds. There have been journals, education programs, brand reminders, physical meeting platforms, and so on. So just to give you an example, how the nature of brand reminders is changing. So yesterday I was with a doctor. I had visited his hospital for some work, and I found that there was a sprayer which was in the doctor's room, probably I think given by some company. So those were not thought of as brand reminders before, but today they have become brand reminders. I understand there are companies who are giving oximeters, the digital thermometers, sanitizing the clinics. So the whole ball game is changing, and it's good part that the industry is quickly adopting to the newer requirements. And special kudos to people in the field that they are reorienting themselves and their team members to use these inputs effectively. But the point I would like to stress upon here is that while you have got plethora of inputs on the digital side, non-digital side, keeping in mind that we'll have to now work consciously with every single doctor as a business opportunity. How do we strategize? How do we set objective? And how do we leverage various inputs available with us to achieve that business objective in a very strategic and a planned manner? Which would also mean that there has to be patience in the whole process. All of you have worked in the market. We have seen that a conversion within one visit or two visit is a rarity. One really has to put in blood, sweat in the market, be after the customers with the same objective again and again. And therefore, a good period of 2 to 3 months maybe would be required to see the conversion and see the success rates. And therefore, being persistent, being patient, being with the same objective for a period of time to see success is very, very relevant. And therefore, working ahead of time based on our secondary requirements will be very critical moving ahead. In addition to this, I think all of you are already exhibiting this, is the team and self digital capabilities. So all this put together would form the framework of each one of us working on planning a conversion strategy and driving conversion of our doctors. I would also like to take you up to another very interesting aspect, which is subtly bringing the change in us. Now, previously, many of you have experience and you have put in lot many years in the industry. Doctors would value someone who talks science to them, someone who talks of big scientific words, terminologies during the interaction with their customers. That aspect of the work will definitely continue, because when you're selling medicines, the science aspect of working can never go away. But what is emerging very strongly is the digital vocabulary, which all of us must put an extra effort to master. I'm struggling with it. I'm still trying to learn. Through my interaction with one of my colleagues, I learned a few new words. And I think that should be the effort and approach for everyone to understand the digital vocab. Not only your doctors would be using this language, your folks in the market, your colleagues in head office, the brand marketing team would be using this digital vocab to a great extent. So we just listed down certain words. We are not going to talk about every word, what does it mean? But my appeal to all of you is whenever you get to hear a word which is part of digital vocab, try to Google, ask your friends, ask your colleagues. There will be a lot of people who are comfortable, and try to understand that word. Because if you start using those words in your conversation with your doctors, I think they would be able to relate better with you, especially doctors, those who are digitally savvy, digitally comfy. Your knowledge of the digital aspect, you will also be able to help doctors who are today not very digitally comfortable. So that would be your handholding with those set of customers. And I think that again will help you to bring closer to your doctors. So words like websites, webinars are common, but blogs, apps, digital medicon, social media marketing, ACO, search engine optimization, driving patient traffic, ORM, online, relationship, reputation management, brand building on social media. Even I'm struggling with some words. Brand building on social media, digital PR networking, digital image building, chatbots, you name it, and they are there. So people talk about being on Insta, FB, I'm a YouTuber, and a whole lot of digital vocab is emerging. We cannot do justice to each and every word now, but once again, I would request you to be attentive to what are the digital vocab which is in the air, and try to understand it and use it to your advantage to connect effectively with your customers who are already digitally strong, to help doctors who are not that many digitally strong, and to understand backend what your marketing teams and many of your younger colleagues would be talking. So it's better we are up on the game and use that language. Uh, this also brings us to some of the very important digital etiquettes. Now, each one of you, you would have taught your people in the market that how to plan, how to dress, how shoes kaise polish hone chahiye, how what sort of a perfume one should wear so that we smell good to our customers. Socks should be very nicely washed and all that stuff. So those were etiquettes which were relevant before. They are important today also. But there are newer digital etiquettes which have come up, especially considering that our interaction with our doctors is significantly high on the digital medium. So one of the important factors, what we learned through interactions with our customers, also inputs if through our previous webinars, is there is a need to check with the doctor about what he or she will prefer to be communicated with, and more importantly, seek permission to send messages on a digital platform. So there could be doctors who would be comfortable with emails, maybe SMS. There could be doctors who would be comfortable with WhatsApp and other messages. So we need to understand what are the preferences of each of my doctor, and also maybe seek permission. So can I send you a message on WhatsApp? Are you okay if I send it to you? So that doctor knows that this gentleman has taken my permission. He is very polite, and I have given him permission so that he would be open to receive your messages. Select mode of communication based on the permission and preferences expressed by your customers. So then may not be only one way doctor would prefer. There could be multiple ways. So it could be an email, WhatsApp, SMS, telephone call, LinkedIn, or mix of these. So based on the doctor profile, what you understand of a doctor, select a mix of digital messaging with the doctors, and use that to connect with that particular customer. Many of the doctors in our interactions have expressed that I get a lot of WhatsApp messages, but I fail to understand who has sent it, because I cannot remember the name and face of every single person in the field whom I meet. And therefore, before you are sending a digital message, maybe it will be a good idea to introduce yourself so that a doctor knows that who is the sender of this particular message. Other important aspect is all of us have our DP pictures in our WhatsApp and other digital accounts. So please try to ensure that you have your fresh DP picture there, so that when the doctor sees, he can relate, okay, this was the person whom I met and he is the one who is sending me that particular message. So that connect with your message, and the doctor recognizing that who is the sender would be much better. It is also important that we use appropriate language, and I'm sure all of you are taking proper care of this, especially when we are going digital. So when you are writing an email, how do we draft that email? What sort of salutation we start with that email? How do we greet the doctor? How we construct that email? Is it too long? Is it too short? Is it well paragraphed? What type of font we are using? So all those are part of digital communication. It's not just words. Another important factor which doctors have expressed anguish is the time of the day they get their messages. And many of them said that my inbox is flooded with messages many times at odd hours, odd times. And that's something which is quite annoying. So understand what is the doctor preference once again, as I said at the beginning, and maybe you can message around that time which doctor is comfortable with. Try to differentiate your message as a because every company rep, every company today, friends, is required to do this. There is no escaping from not communicating with the doctor through digital interface. But unless my message, the what I want to convey to the doctor is not different from what the doctor's inbox is flooded with, chances are that what I want to communicate with my doctor would get lost in that plethora of messages which doctors tend to get today. So how do I differentiate? How do I use the attention grabbers, if I can use that word, so that my message captures doctor's attention? It is similar or akin to what all of you have taught your people, that when you go to detail your products to a doctor, how do you attract your doctor's attention at the start of your conversation so that the doctor is attentive to what you are communicating with. It's something similar to that. And lastly, in addition to your brand messaging, try to see if you can balance it out between with messages of other nature. So there can be updates of the events which your organization is planning to do. There could be invitations for some of those events. You can acknowledge a doctor that if he has attended one of your webinar, maybe acknowledging is another form of reminding. Season's greetings, wishing for their and family good health, appreciation of some good work the doctor has done, or possibly you have seen a nice article written by a doctor on, say, FB or on the doctor community page or patient community page. Appreciation message would be valued by your customer. Maybe a thank you message. So there are different formats of messages which one needs to use in addition to the brand reminder messages. Remember, each of that message is a connect, and a doctor would definitely remember your messaging of different nature in addition to your brand reminder messages, and obviously that will lead to a reminder to the product which you have promoted to your customers. So these are some of the digital etiquettes which have emerged. It's not that this is the only set of etiquettes. There could be some more. I'm open to additions from your side. So, but these are some which we felt through our interactions with various experts in the field, that these are bare minimum one must keep in mind. I would once again like to come to this, which is customer-centric selling. Uh, Understand the business is likely to change, is already changing. Many of you have expressed through our interactions that the good old days of focusing a lot on distributor to get the balance part of our monthly targets is becoming more and more challenging. Many of you have said that at least about 2 days are spent in a month. Now, 2 days might sound small, but add up to a year, which means every member of your team, equivalent to 24 days in a year, is spending on sales closing, and all of that time would be spent at the distributor level. It's a very, very big opportunity loss on putting that effort on converting customers and building the demand. The distributors also feeling the pressure of the environment would be more conservative in their approaches. So what we envision that getting those extra orders month after month from the distributors is going to be difficult. They have their limited resources, they would be playing in them. And on the other side of the spectrum is also what is seen is once we start getting into this sort of phenomena, quite often the compromises on the work hygiene can crop in, which is a big work hazard one must guard against. And therefore, the only option I have is to be very consciously focused and move towards customer-centric sales planning. And now remember, if all of you have said that around 50% of your customers are low contributing doctors, doing a good work for solid 3-4 months on exploiting this opportunity from this set of customers with a very particular business objective set for this type of doctors, and guiding your team member on how to create a conversion strategy, how to consistently behind that objective for a period of next 3-4 months. We are confident that you will see a traction on your secondary, and the gap between your target and secondary will start reducing with this particular approach. Your dependence on distributor oriented selling will come down, and your demand based performance achievement will go up. Please don't misunderstand me. I am not for a second saying that the distributor's role is not important. No, that is not the point. They are absolutely important customers of our whole journey, but they contribute significantly in demand fulfillment and demand servicing, which you and your team members are putting efforts in the market to create that demand. Unless it is a very, very high-end super specialty business, the role of distributor would be to a great extent restricted to demand servicing and demand fulfillment. Demand generation has to happen at customer level, and already based on the survey all of you have taken, there is a huge opportunity in your doctor list to tap that. Please guide your team members to focus and extract that opportunity for your benefit. So that's what some of the key points we wanted to talk to you about the customer-centric selling, which will take center stage as we move ahead on this journey. We'll share this template with you. It will be emailed to everybody. We just thought of putting how can you capture the digital persona of your doctors. It's a very simple format. The Excel sheet will be mailed. You can change, edit as per your requirements. Maybe you can start with 5 doctors in a rep's territory or 10 doctors. Slowly see the benefits of it, understand if there are any changes required in this template, and then you can introduce it to more doctors in times to come. So it captures the name and various digital media preferences, personal interest areas, preferred time for digital contact. So I think this would help you to work more planned approach in terms of how do we connect digitally with your customers. So in addition to the functional skills, what we discussed about, which was driving demand-based business, focusing on customer conversion, data analysis, people skills, and remote engagement. And a big chunk would be on the customer management. Some of these softer skills which would come into play, they have been shared with us. So these are some of the softer skills which would be relevant. It would be difficult for any organization to support your development on each of these areas. There is enough material available in our environment, in our surroundings. Every interaction with every individual we have in the market, there is a learning. There is a lot of Google stuff available. Interacting with our peers, try to work on building some of these soft areas to your advantage. With this, friends, I'm very, very happy and proud to launch a product which is aimed at building ABM capabilities. This is an initiative, this is an intervention. We are calling it as ABM Capability Enhancement. This is first online ABM Capability Enhancement program from Nextplan Consulting. So let me tell you what this program is all about. But before that, I would like to first share with you what are the key highlights of this program. So this is a certification program. So on completion, you will get a certificate which you can include it as part of your resume. You can show it proudly. And the program, as I said, is designed exclusively for the first line managers. This content has already been tested with a large number of ABM pool, and we have got excellent response for this content. We'll be covering 5 topics spread over 12 to 15 hours of facilitator-led online learning. So it is not a purely e-learning curriculum. There will be a facilitator who would be working with you through online platform like Zoom. But because it is online and the timings are planned in such a way that there is no off-field or loss of work for all of you. There will be learning augmentation post the program with projects. Which will have relevance to your direct application to your work. We'll also provide you additional reading material, and there will be templates given to you which you can apply to your workplace. What we have seen benefits based on our experience about this particular content is it has a direct impact on how you can bridge the gap between your target and secondary. So the program will tell you how can you strategize for your customers, how do you set business objectives, how should you plan for conversion, and therefore the end result will be a reduced shrinking gap between your target and your secondary sale, which means you are moving away from your distributor-centric sale to a customer-centric sale. How do you strategize to get increased contribution from every single doctor? how do you systematically reduce the number of low contributing doctors? All these are linked to each other. Reduce time spent on sales closing. Now, remember, if you can drive the secondary increase uh, so that your target achievement is demand based, and your team members are spending lesser and lesser time on sales closing, moving on to a situation where they don't have to just go to a distributor for getting orders for target completion. They will definitely be visiting the distributors for various other aspects of the work, but may not be required to go and get extra orders. Now, we have seen the industry at the distributor's place every month end, again and again, at least for last 2 to 3 days. Resolve, I have gone through it many times. I have experienced the pain of it, and that was actually the driving force of putting this whole content together. Resolve critical and recurrent issues in a planned manner, and how do you drive team engagement and motivation. So with this, let me now share with you what are these 5 functional modules which we have incorporated in this program for ABMs. One is how do you enjoy playing with your numbers? As I said in the beginning, you work on multiple data points. So how do you work on these data points, drive meaningful engagements, and use it to plan actions? There will be a module on problem solving through root cause analysis, customer profiling, segmentation, and targeting, much more detailed than what we discussed here. Sales by Design is a program completely aimed at achieving your targets in a designed manner. And how do you conduct effective performance discussions? What you will get end of this session is a certificate of completion from Next Plan Consulting, which you can proudly display in your resume. And whenever you're talking and going to approach for your next level movement, there will be post-program learning augmentation with additional reading, reference material, and ready-to-use templates, which you can apply in your day-to-day work. So friends, thank you for your time. I thoroughly enjoyed it. I'm sure you would have enjoyed it. With that, wishing you and your family a very strong emotional, social, financial, and physical well-being. Friends, stay safe and stay healthy. That's all from Next Plan Consulting.